Welcome to the Deep Dive. Today we're tackling something really fundamental.
We are indeed.
We're going deep into understanding what mental health truly is and also getting to grips with the Mental Health First Aid Action Plan.
That's right.
Now, if you're joining us as a learner on our UK online course, think of this as, well, a bit of a shortcut to the absolute core knowledge in those first couple of modules.
Yeah, like a foundation builder.
Exactly. And our mission today, to pull out the most vital stuff about mental well-being and, crucially, how we can all offer that initial support when someone needs it.
Precisely. Think of it as us doing the heavy lifting on the essentials, giving you that solid base as you work through the course materials. It's not just definitions, is it?
No, not at all. It's about understanding the real impact and the practical things we can actually do.
Okay, let's dive in then.
Right. So what's first things first? What is mental health? We hear the term all the time, but what does it, actually mean?
Well, the material defines it as our overall psychological well-being. It's much broader than just not having a diagnosis.
Right.
It covers our mood, our thoughts, how we behave, our emotions, essentially how all those pieces kind of work together.
So it really shapes how we function every day, how we think, feel, act. And that must have a huge knock-on effect.
Absolutely huge. It touches everything, how we concentrate, whether that's studying for you on the course or at work, how we connect with people.
Right.
And as you get deeper into the course, you'll see just how important it is to recognize common mental health issues. The document lists quite a few.
Yeah, I saw that. Things like depression, anxiety disorders.
Bipolar disorder, schizophrenia, eating disorders, difficulties with substance use, PTSD. It's a wide range.
It really is. And the document makes a point that feels incredibly important, that these issues aren't a sign of weakness.
Absolutely critical point. The text really stresses they are not the person's fault. It's not about lacking willpower or being weak.
And recovery is possible.
Definitely. That's a key message. With the right support, the right help, people can and do recover and lead really fulfilling lives.
Which brings us straight to a massive hurdle, stigma and discrimination. It's just, it stops people getting help, doesn't it?
It really does. These negative attitudes, these stereotypes, they're still so ingrained, unfortunately.
And this stigma leads to actual discrimination.
Yes, and the document points out how this becomes a major barrier. People are afraid to reach out because they fear judgment or negative consequences, and it just adds another layer of difficulty piling on top of what they're already dealing with.
So challenging these attitudes is something we all need to do. What does the source suggest? How can we help create a better environment?
Well, it really highlights the power of just offering support without judging, simple as that sounds.
That's powerful.
And providing accurate information about mental health. That helps break down those myths, those harmful ideas, and makes it feel safer for people to actually speak up.
Okay, so that's tackling the negative side. What about proactively building good mental health? What does the source say about promoting well-being?
This is about the positive steps, yeah. The material outlines several key things. It talks a lot about encouraging healthy lifestyle choices.
The usual suspects. Diet, exercise.
Exactly. Balanced diet, regular physical activity, getting enough sleep. We know intrinsically these things matter for our mental state, but the evidence is strong too.
Makes sense. What else?
Social connection is a big one. So encouraging things that build those connections, spending time with people you care about, maybe volunteering, joining groups, it all helps.
Finding your tribe.
Kind of, yeah. And also just making time for things you enjoy, hobbies, being creative, whatever it is that gives you a lift, that builds resilience.
Right.
And of course, a really practical point, knowing where to find help when you do need it. So having info on local support services is key.
It sounds like all these things together help us build up our ability to cope when life, throws things at us.
That's exactly it. You're strengthening your capacity to handle challenges. And it's vital to remember, as the document points out, mental health isn't static. It's not fixed. It exists on a spectrum.
Like a sliding scale. Good days, tougher days.
Precisely. We all move along that scale. Fluctuations are totally normal, part of being human. But if someone's having persistent, significant difficulties, that's often a sign they might need some extra support.
And those difficulties can show up in so many ways in daily life. The source gives some concrete examples, doesn't it?
It does. Things like finding it really hard to concentrate or make decisions, changes in sleep, maybe sleeping way more or way less, same with appetite,
Low energy.
Yeah, feeling constantly drained, no motivation, or getting stuck in negative thought patterns. And sometimes you see noticeable changes in how someone behaves or in their relationships. Recognizing these impacts is step one to offering support.
Okay. So what makes someone more likely to experience poor mental health? What are the risk factors?
The source lists several big life events or ongoing stress things like a relationship ending, losing someone, money worries. Those can definitely play a part.
Trauma as well.
Yes, experiencing trauma, like abuse. Also, misusing substances, alcohol, or drugs. Having long-term physical health problems can increase risk too, and sometimes there's a family history.
But these aren't guarantees, right? They just
Yeah,
increase vulnerability.
exactly. That's a crucial distinction the text makes. These factors don't automatically cause poor mental health, but they can make someone more susceptible, more vulnerable to developing difficulties.
And when someone is struggling, where should they turn?
The document really highlights getting support from different places. Friends and family can be amazing, of course, but
Uh,
also professional help is vital.
like therapists, counselors?
Mental health professionals, yeah,
Yeah.
or even confidential helplines for immediate support. And the key thing is getting help early can make such a difference. It can potentially stop things from getting more serious down the line.
That link between physical and mental health is really interesting too. The source emphasizes that. We often separate them in our minds,
But they're so interconnected, aren't they? It's a two-way street. Poor physical health can definitely impact your mental well-being.
like dealing with chronic pain, perhaps.
Exactly. That can increase the risk of depression or anxiety. And conversely, if someone's struggling with their mental health, it can sometimes make it harder for them to manage their physical health conditions effectively.
And our environment matters too. The workplace gets a specific mention.
It does. Work can be a massive influence, sometimes positive, sometimes, unfortunately, negative. A supportive workplace can be protective, but a really stressful or toxic one.
Oh, well, that can contribute to problems.
Employers have a role to play there.
Definitely. Creating a positive atmosphere, maybe offering flexible working, access to counseling, well-being programs, that all helps.
And personally, the idea of self-care keeps coming up. It's more than just pampering, isn't it? Oh, absolutely. Self-care is fundamental. It's about consciously looking after your physical, emotional, and mental needs in a balanced way.
So what does that look like?
It can be anything, really. Regular exercise, relaxation techniques like mindfulness, having hobbies, spending time in nature. The key is figuring out what works for you, what genuinely helps you recharge, and then actually making time for it. That builds resilience.
We mentioned stigma earlier, but the document comes back to it with some really stark examples.
Yeah, it makes it very real. Things like hearing negative jokes or comments about mental illness, seeing harmful stereotypes repeated, people being unfairly denied jobs or housing because of a mental health condition.
Even issues with insurance coverage.
Exactly. All these things show how stigma isn't just an attitude, it has real damaging consequences. It creates huge barriers to people getting help and just living their lives.
So promoting good mental health isn't just an individual thing. It needs a wider shift.
Absolutely. The document frames it as a collective effort. We need to actively encourage people to seek help when they need it. We need better education about mental health for everyone.
Creating those supportive environments we talked about.
Yes, at work, in schools, in communities, and actively challenging stigma wherever we see it. The goal is a society that's genuinely more accepting and supportive for everyone's mental well-being.
And to help us understand better, the text digs into more specific types of mental health issues.
It does. It expands on that earlier list, talking about broader categories. So anxiety disorders, that includes things like generalized anxiety, panic disorder,
Okay.
mood disorders like depression or bipolar disorder, which involves those big shifts in mood and energy, substance use disorders, psychotic disorders like schizophrenia, which affects thinking and perception.
Eating disorders too.
Yes, and personality disorders. It's important to remember these conditions vary a lot in severity, how they show up, the specific symptoms. And someone might experience more than one condition at the same time. That's quite common, actually.
Wow, okay. So all this understanding, this context, it sets the stage for a really practical tool introduced in this first module, the Mental Health First Aid Action Plan, ALGE.
That's the one, ALGE. It's presented as a really structured step-by-step approach, a way to provide that crucial initial support if you notice someone struggling or if someone reaches out.
So it gives you a framework.
Exactly. The acronym helps you remember the steps. A, assess for risk of suicide or harm. L, listen non-judgmentally. G, Give reassurance and information. E, encourage appropriate professional help. And E, encourage self-help and other support strategies.
Okay, ALGE. It's designed to guide us in those first moments.
Precisely. It's about offering immediate support and, importantly, helping to connect the person to the professional help they might need for the longer term. And Module 2, well, that really unpacks how to apply each of those steps effectively.
Right, which is exactly where we need to go next. We've laid the groundwork, understanding the what's and why of mental health. Now let's get practical and talk about using that mental health first aid action plan.
Okay, so we're shifting gears now from the theory, the understanding, into the practical application. How do you actually use the ALGE action plan?
Yeah, step by step. The first step is A, assess for risk of suicide or harm. That sounds like a heavy responsibility, but absolutely critical. What are we looking for?
It is critical, and it's about being aware of warning signs. Is the person expressing thoughts of ending their life? Are they engaging in self-harm? The document stresses that if you do suspect immediate danger,
You act immediately.
you absolutely have to. Don't hesitate. That means contacting emergency services, calling a crisis line, or getting a mental health professional involved right away. Safety first.
Okay, then comes L, listen non-judgmentally. We all think we're good listeners, but what does this really mean in this context?
It means creating a space where the person feels safe, heard, and, importantly, not judged. It's about being fully present.
So, putting your phone away, making eye contact.
Yes, active listening, nodding, maybe reflecting back what they've said just to show your understanding. So it sounds like you're feeling really overwhelmed. Avoid interrupting. Avoid jumping in with advice immediately.
Just listen.
Just listen and validate their feelings. Simple phrases like, that sounds incredibly difficult, or I'm so sorry you're going through this, can make a huge difference in building trust.
That trust seems vital for the next step.
Yeah.
Give reassurance and information. What kind of reassurance and information are we talking about?
Reassurance can be about letting them know they're not alone, that help is available, and that things can get better. The information part isn't about diagnosing them, absolutely not.
Right.
It's more about general information, perhaps explaining that mental health issues are common, treatable, and not a sign of weakness. You might gently counter any misinformation they have. It's about offering hope and facts, calmly.
Got it. Next is ESI. Encourage appropriate professional help. This can feel like a tricky conversation, suggesting someone needs professional support. How do we approach that?
It can be delicate. The key is to frame it positively. Emphasize that seeking help is a sign of strength, like going to a doctor for a physical issue. It shows self-awareness.
Not weakness.
Definitely not weakness. You could offer information on types of help available, maybe talking therapies, medication options, support groups. Reassure them about confidentiality. Explain that professionals have the expertise to really help them figure things out and feel better.
So it's about empowering them to take that step.
Exactly. And sometimes offering practical help, like finding contact numbers or even offering to go with them to an initial appointment, can make a big difference, but always respecting their decision.
And the final lead, encourage self-help and other support strategies. We talked about self-care earlier. How does it fit in here in this first aid context?
Here, it's about suggesting small, manageable things they might be able to do now or soon to support their well-being. Maybe reminding them of strategies that have helped them before.
Like going for a walk, listening to music.
Simple things, yes. Or basic stress management, like deep breathing. Gently encouraging connection with supportive friends or family they trust. Providing info on reliable self-help resources, like reputable websites or apps. It's about reminding them they have some agency, even when things feel tough.
The plan is really focused on that initial support, but the document also talks about supporting long-term recovery. Mental health isn't a quick fix, is it?
Not at all. Recovery is often a journey, a process. The first aider's main role is that initial contact and connection to help, but continued encouragement can be really valuable.
How so?
Well, if appropriate, checking in sometimes, gently encouraging them to stick with professional help if they've sought it, maybe sharing information about ongoing support like local peer support groups, and just continuing to be a non-judgmental, supportive presence in their life, reinforcing those self-care messages.
It's vital to remember our limits, though. The text is clear. Mental health first aid isn't therapy.
Absolutely crucial point. MHFA is first aid. It's like physical first aid. You stabilize the situation, prevent things getting worse, and get the person to professional care. You are not a therapist or counselor.
Knowing when your role ends and the professional's begins.
Precisely. Recognizing when someone needs that special support and making sure you facilitate that connection is key. Don't try to take on more than you're trained for.
And following up seems important too. Just checking in after you've used the action plan.
Yes, the document mentions follow-up. If it feels appropriate and you have that kind of relationship, checking in later to see how they're doing, if they manage to connect with services, it shows continued care.
Again, respecting boundaries.
Always. But that follow-up can reinforce that someone cares and might encourage them if they're finding it hard to stick with treatment or support.
Now, doing this, offering this kind of support, it can be emotionally demanding for the person providing the first aid. The text flags the need for self-care for the first aider too.
So important. You absolutely have to look after your own mental health. It can be tough hearing about someone's distress.
You can't pour from an empty cup.
Exactly that. So the document suggests reflecting on the experience, talking it through with your own support network if needed, making sure you do your own self-care things, whatever recharges you. And if you find it's affecting you significantly, seeking your own professional support is okay too.
Good, that's included.
Yeah.
The module also loops back slightly, adding a bit more depth on understanding symptoms and causes.
Yeah, just to enrich the context, it reminds us symptoms can range hugely, from mild to severe, affecting mood, behavior, thinking, and reinforces that causes are usually complex, that mix of biological, environmental, psychological factors we mentioned earlier. It just helps build empathy.
And it adds a few more practical support strategies.
This builds on the ALGP plan, really, reiterating the importance of persistently encouraging professional help, offering diverse resources, local, online, whatever fits, supporting the journey of recovery, not just the crisis point, and always, always coming back to creating that safe, non-judgmental space for them to talk.
And finally, it hammers home that point about stigma reduction again. It feels like the thread running through everything.
It really is. Because all the best action plans and understanding are undermined if stigma stops people reaching out or feeling safe. The document finishes Module 2 by reinforcing that reducing stigma is everyone's job. Promoting understanding, fostering inclusion, it benefits everyone.
This has been incredibly useful, a really thorough deep dive into both understanding the landscape of mental health and getting practical with the mental health first aid action plan, especially, I think, for all of you on our UK online course.
Definitely. We've covered a lot, from the basic definitions and the impact of mental health issues, right through to the concrete steps of the ALGE plan for providing that vital initial support.
We really hope this gives you a solid foundation, a strong grasp of these core concepts from your first couple of modules. Understanding this stuff and knowing that action plan, it's such an important starting point.
It really is. It empowers you to potentially make a real difference when someone around you is struggling.
And look, this has been focused on those foundational modules. If you want to go deeper, get a more comprehensive understanding, and explore the further modules which cover things like specific crises, substance use issues, and more.
Then we absolutely encourage you to purchase the full online course. It really builds significantly on what we've discussed today.
Yep, and you'll find the link for the full course right there in the description below this video. Super easy to find.
Remember, learning about mental health, learning how to support others and ourselves, it's an ongoing process. It's not something you just tick off a list.
Absolutely. Every bit of knowledge, every supportive conversation, it all contributes to building healthier, more compassionate communities for everyone. Thanks for diving deep with us today.